The community plan is to alleviate loneliness in seniors living in Monona, Wisconsin. I've developed a small public health project aimed at educating seniors in Monona, Wisconsin about the health impacts of loneliness and things to do to avoid loneliness. I developed a relationship with the Monona Senior Center Program Coordinator, Lisa Brooks, and in initial discussions with her, we came up with a concern that they've had for a long time, that there were lonely and socially isolated seniors in the community, and that more outreach needed to be done to involve them in the programs and services. And so the nursing process was applied to the problem of senior loneliness in my community. First, it's important to define the community, and the community is the senior population of Monona, Wisconsin at risk for loneliness. So a definition of community can involve the geographic boundaries, which would be Monona, Wisconsin, and also in community health, you define communities by geographic boundaries because it's useful to analyze health needs in a specific target area. And then two other ways of defining community are to describe and define a group of people with shared interests or people with a shared health problem. So that would be the seniors at risk for loneliness, and confining it to a specific area helps you focus on a specific group in that area. Another important part of the assessment process is a windshield survey, which you do by basically driving or walking around your community for an hour or two. And it's a way of rapidly assessing a community, and it helps you identify strengths and potential public health needs. You can get a quick view of services, how well the buildings are, how the state of repair buildings, environmental problems, transportation infrastructure, geographic characteristics, how the schools look, what the state of the roads are, just the general look and feel of the community, and you can look at it to see whether things stand out. And the thing about my community is it's a thriving, healthy, small suburban community near the capital city of Wisconsin. It's pretty I guess what I'm trying to say is that there was no obvious pressing problems visually in this community. Only one thing that stood out visually to me was that there was very few sidewalks in the neighborhoods, and that could present a walkability problem. But other than that, I didn't see much. So I basically would have to dig deeper and look at more assessment. And that further assessment is looking at the data about the population, and because looking at the population may give insight into public health needs. So you look at population characteristics like population characteristics data and healthcare infrastructure data, and you try to look at themes and trends in that data to look for possible need for public and community health interventions. And then you can also look at specific population groups to develop relevant interventions for that group. So starting at the top here, the population and population density of Monona is about 8,624 with a population density of 2,600 people per square mile. And comparing that with Wisconsin overall, which is very rural, it has a population density of 110 per square mile. And neighboring Madison, the state capital, has a population density of 3,400 per square mile, and the largest city, Milwaukee, has a population density of 6,000 per square mile. So Monona is less dense than some of the other major cities. As you can see from Figure 1, the population in Monona is overwhelmingly white, about 85%, and the remaining 15% is made up of 5%, 2 or more races, 2% identifies as other, 2% is Asian, 2% is Black, and there's 5% Latino. The leading causes of death are similar overall to the country. Cancer, heart disease, accidents, cerebrovascular disease, lower respiratory disease, suicide, and diabetes. The rate of disability in Monona is 9.7%. Interestingly, 32.4% of the population over 65 has some disability. And another important statistic to my project is in the last 4 to 5 years, well, from 2015 to 2019, 50% of women and 29.8% of men over the age of 85 lived alone. And that's a risk factor for loneliness, so I just want to point out that statistic. And also highlighted on the slide is the median age of Monona's population is 43.3 years, and 25% of the population is 65 or older. And to compare that, the Wisconsin average age is 39.5, and the average age of the U.S. overall is 38 years. So Monona's population is older overall. So after assessing the community, and I came up with a diagnosis of risk for loneliness among senior citizens related to increased risk factors that contribute to loneliness that include affectional deprivation, emotional deprivation, and physical isolation and social isolation. And I just want to define loneliness. The risk is defined as being vulnerable to experiencing discomfort associated with a desire or need for more contact with others, which may compromise health. So that's the community diagnosis. The next step is to devise a community health plan, and that really is goals that are developed in the planning stage of the nursing process after an assessment and diagnosis are made. And the goals are SMART goals, which means they're specific, measurable, achievable or attainable, depending on which word you want to use there, relevant, and time-based. And 2 short-term goals and 1 long-term goal of this project were come up with. The first short-term goal was to distribute a flyer and a bookmark that provides education about loneliness and how the Monona and the Monona Senior Center programs, and distribute them to at least 5 community sites. And this was completed on February 24th, 2022. And the second short-term goal was to develop a web page, and that was completed on February 23rd, 2022, and at the website page shown on the slide. And goal number 3, it's not yet achieved, but The goal is that the utilization of the Monona Senior Center programs and services will increase by 15% within 2 months of the project. The Senior Center collects that data already, so this will be an easy one to analyze and determine whether it was successful. The next stages of the nursing process involve implementing and then evaluating these goals. In the effort to achieve the goals of a community health project, partnerships and form of collaborative relationship with community organizations or persons are often needed. A community health resource is also an organization or person that provides valuable services such as economic support, medical or dental services, nutrition service, expert knowledge, or transportation. And so my community partners were Lisa Brooks, the program coordinator at Monona Senior Center, and then also Newbridge, an organization in the community that provides services and activities to seniors. So relied on those for collaboration and resources. I heavily relied on information supplied from the National Institutes of Health, National Institute on Aging. They have a lot of evidence-based information and outreach toolkits available that really helped me put together the information for the flyers and webpage, etc. And then the Monona Senior Center itself is also a resource because it's supplying materials to print flyers and other services that I need to complete the project. So the interventions are the educational materials, are the web page, the bookmark and flyer, and then also the web page information is also going to be in an article that'll be in the Monona Senior Center newsletter, but that won't be published until next month, so it really isn't in scope to be finished by the end of this project time frame, but I just wanted to include it because I'm also going to be doing that. So it's an education and outreach project, so those are the things that I've done. The evaluation was done. Evaluation is essential to the nursing process because it allows the nurse to determine whether the goals were achieved through the intervention. So the bookmark and flyer as a short-term goal was distributed to five sites on February 24th. A link to the flyer is also available on the webpage shown on the slide. This wasn't listed as a short-term goal, but I also developed a newsletter article that's going to be published on March 10th, and that was delivered to the liaison at the Senior Center. The website has been improved, and the loneliness webpage is finished and published at the website shown on the slide. And then data on the Senior Center participation that may have increased through the intervention will be analyzed in 2 months to determine if participation has increased by 15%. This data is already collected by the Senior Center, so this will be fairly easy to implement because I will just ask for the data from the Senior Center and they will give it to me, and then I'll analyze it about program participation. So the partnership with the Monona Senior Center helped reveal a growing concern among the Senior Center staff that there was a problem with loneliness and social isolation among the elderly population in the community. And using the community health nursing process, educational interventions were using both print and digital media were developed to help the Monona Senior Center reach out to lonely seniors and educate them about the health risks of loneliness and social isolation and involve them in Senior Center activities. The following 2 slides contain references.